This is a classic example of severe osteoarthritis, and I wanted to show you this example because it demonstrates this piece, which is an osteophyte, this fragment, which shows ebonation. Right here under the zone of ebonation, you see thickening of bone, and that is subchondral sclerosis. Beneath that, you see some loss of bone, osteoporosis, although I seldom comment on osteoporosis on a resection, and I'll tell you why in a second. And finally, there's a piece of meniscus which suggests that this is from the knee joint. So let's start by talking about ebonation. Ebonation is the complete loss of cartilage, and instead what you see is a knife-like defect in the bone, and the bone reacts to this process by thickening, and this is exactly what you're seeing. This is subchondral sclerosis. You can see that there's increased cellularity of the bone, very many more osteocytes than you will normally see, and the thickness is best appreciable on low power. Notice how thickened this is and how non-thickened these trabeculae at the bottom here are. Here's another very common finding you will see. Right under that thickened bone, you will see cysts. This is a relatively small cyst. The cysts can look very large in size, and they typically lack a lining epithelium. And then there are these bud-like processes that are growing off the ebonation. There's nothing more else I can say about this except that this is some sort of an artifact that you occasionally do see in degenerative joint disease. Let's take a closer look at the osteophyte. I always think of the osteophyte as a piece of extra or new bone which is growing at the edges of the existing bone. So this is what must have constituted the existing bone, and everything beyond this site here is new bone formation, and this is the osteophyte. The osteophyte is often covered by fibrocartilage rather than hyaline cartilage, which is typically covers the articular surface. And beneath that fibrocartilage, you will see this rather cellular bone marrow. If you notice, the rest of the bone marrow did not look particularly cellular, but the area immediately under the osteophyte tends to show trilineage hematopoiesis. Now to the piece of fibrocartilage on this slide. This fibrocartilage, I can assure you, shows very significant degenerative changes, and that is evidenced by the fact that it has this bluish hue as opposed to a uniform pink hue that a fibrocartilage from a 15-year-old would typically show. And when you look at this on higher power, you'll clearly see why I'm calling this fibrocartilage. These look like chondrocytes. There's a space with a nucleus in it, and the fibrocartilage is not only variegated in color with a hue mix of blue and pink, which indicates a degenerative change, but also the chondrocytes are reacting, and the cellularity of these chondrocytes is significantly more than what you would see in the normal meniscus. So this is not only degenerative joint disease, severe osteoarthritis with ebonation and osteophyte formation, but this also shows a degenerated meniscus.